Schizophrenia is a serious brain disorder that distorts the way a person thinks, acts, expresses emotions, perceives reality, and relates to others. People with schizophrenia often have problems functioning in society, at work, at school, and in relationships. Schizophrenia can leave its sufferer frightened and withdrawn. It is a lifelong disease that cannot be cured, but usually can be controlled with proper treatment. The condition was originally termed dementia praecox, which means premature mental deterioration. The term schizophrenia, meaning split mind, was introduced in 1911. Contrary to popular belief, schizophrenia is not about a split or dual personality. The split refers to a disconnect between emotional and intellectual aspects of experience, a lack of synchrony between emotional expression and current experience. Schizophrenia is a psychosis, a type of mental illness in which a person cannot tell what is real from what is imagined. At times, people with psychotic disorders lose touch with reality. The world may seem like a jumble of confusing thoughts, images, and sounds. The behavior of people with schizophrenia may be very strange and even shocking. A sudden change in personality and behavior, which occurs when schizophrenia sufferers lose touch with reality, is called a psychotic episode. Schizophrenia affects about 1% of the population worldwide, but it's estimated to be more common in the US and Europe than most third world countries. It's likely that this discrepancy in rates simply reflects differences in record keeping or diagnosis, but some have suggested that it might reflect differences in diet. Diets high in fat and sugar may be associated with increased symptoms, diets rich in fish associated with decreased symptoms. Though rates between men and women are roughly equal, schizophrenia is slightly more common in men, around a 7:5 ratio, is slightly more severe in men, and appears to have a slightly earlier onset in men. For males, schizophrenia appears in the teens and early 20s. For females, it generally starts in the late 20s. Schizophrenia rarely occurs in children, but it is possible. Schizophrenia is a term given to a complex group of mental disorders. However, different types of schizophrenia may have some of the same symptoms. Symptoms can be classified as positive or negative, but this doesn't refer to whether they are good or bad. Positive symptoms are psychotic behaviors not seen in healthy people, such as hallucinations or delusions. Negative symptoms are associated with disruptions to normal emotions and behaviors. They are things that healthy people would normally have, but are lacking in people with schizophrenia. For example, flat affect, a lack of emotional experience and expression, or social withdrawal. Media portrayals of schizophrenia add to the stigmatization of this disorder. Schizophrenics are often thought of as violent and completely disconnected from reality, unable to function in society. While some people with schizophrenia do need to be institutionalized, there are many who suffer with less severe forms of the disease, who lead rewarding and meaningful lives in their communities. Disorganized thoughts and speech is perhaps the major symptom of schizophrenia, perhaps due to memory impairments or some other strain placed on cognitive functioning. The diagnosis of schizophrenia is not an exact science, however. Although it's been considered a unique disease for over a century, its definitions and boundaries have changed over time, and its etiology and pathophysiology remain elusive. In the DSM-5, released in 2013, the diagnostic criteria were again revised. Changes in its definition included the elimination of the classic schizophrenia subtypes because of their low reliability and poor validity. These subtypes included paranoid, disorganized, catatonic, undifferentiated, and residual type. and individuals must now have at least one of three positive symptoms of schizophrenia: hallucinations, delusions, or disorganized speech. When I suffered damage to my inner ear, creating disruptions to normal hearing, along with balance and coordination difficulties, I found myself struggling for weeks to think and speak as clearly. It was as if there was cotton wool muffling my thought processes. As someone whose profession depends on intellectual thought and clear communication, it was very distressing, and I'm convinced that a large part of the problem was due to the increased mental load as my brain was trying to make sense of the dramatic disruption in vestibular and oral input. While I doubt I would have satisfied the criteria for diagnosis with schizophrenia, it demonstrated how fragile mental processes can be and how easily they can be disrupted. In diagnosing schizophrenia, therefore, it's important to explore differential diagnoses, to rule out other conditions that might create similar symptoms, such as Huntington's disease or niacin deficiency.